When you think about businesses that are selling through the roof, like Aloe or Allbirds, sure, you think about a great product, a cool brand, and great marketing. But an often overlooked secret is actually the businesses behind the business, making selling, and for shoppers, buying, simple. For millions of businesses, that business is Shopify. Nobody does online business better than Shopify. It's home of Shop Pay, the #1 checkout in the world. You can use it to boost conversions up to 50%, meaning way less carts going abandoned and way more sales going through to checkout. Sign up for your $1 per month trial period at shopify.com/income, all lowercase. Go to shopify.com/income to upgrade your selling today. That's shopify.com/income.
Hi everyone, I'm Deb Flashenberg. Welcome to Yoga, Birth, Babies, a podcast produced by Prenatal Yoga Center. We will be diving into everything prenatal yoga, birth, and baby related, hoping to inspire, educate, and empower you through your journey into motherhood. Thank you for listening.
Hi, I'm Deb Flashenberg, and I'm your host of Yoga, Birth, Babies. And today we have Dr. Jessica Vernon on speaking about her new book, Then Comes Baby. This book covers a wide range of pregnancy and postpartum experiences. And we are going to dive deep into talking about PMADS, perinatal mood and anxiety disorder, as well as really examining the postpartum care system that we have set up in our country right now and looking at where are some of the cracks in the systems, where are some of the gaps. We'll also dive into looking at some of the biggest misconceptions around pregnancy and childbirth. Jessica addresses those and challenges those in her book. And this wouldn't be a conversation about postpartum if we didn't talk about matrescence, that shift from maiden to motherhood, into that new transition in one's life. One thing I think is really unique about Jessica's story in this book is that she puts a lot of herself in there. She talks about her own struggles with postpartum depression and anxiety. And what I think is really remarkable and brave about that is that here she is, someone that has been in the reproductive world for so long and still met these struggles. And I think that just helps normalize it, thinking if a doctor's having this, it is something so common that we often think, oh, that can't happen to me, but it can happen to anyone and everyone. I believe the statistics are 1 in 5. Those are the reported statistics. It's probably more like 1 in 3. So I just appreciate how Jessica opens up and shares about her own experience. Let me tell you a little bit about Jessica. So Dr. Jessica Vernon is a board-certified OBGYN who has cared and supported thousands of people throughout their reproductive journeys over the last 15 years. She's the Associate Medical Director and Director of Mental Health at Oula, a midwifery-based women's health startup in New York City. She's also, as I mentioned, the author of the book, Then Comes Baby. As a mom of 2, she brings her lived experience and the transition of parenthood into her work. I think you're going to get a lot out of this conversation. So before we get to that, I always love to give some updates about what's happening at Prenatal Yoga Center. So really, honestly, the best way to find out about our latest class schedule and workshops and on-demand library is to head to our website, prenatalyogacenter.com. Everything is there. Not only do we have about our classes and workshops, but I have a blog, I have free videos, and you can also sign up for our newsletter. I send it once a week. It has little tips, it has videos, it has some info about our community and pictures from our community. So you can sign up for that also on our website. You can also find out about our teacher training also on our website. All right, so head over there, check it out. We're going to take a quick break. And when we come back, please enjoy my conversation with Dr. Jessica Vernon.
Introducing Meta Ray-Ban Display, the world's most advanced AI glasses. With a full color display built into the lens of the glasses, it's there when you need it and gone when you don't. Send and receive messages, translate or caption live conversations, collaborate with Meta AI, and more. Be one of the first to try Meta Ray-Ban Display. Visit meta.com/Meta Ray-Ban Display to book a demo and find your pair.
Hi, Jessica. How are you?
I'm doing great. How are you, Deb?
I'm doing really well. I'm really excited to speak with you about your book. I had the wonderful opportunity to read through it. It's fantastic. And you know something, I didn't realize that you and I tried connecting a while ago when you had another project. So I'm glad that we're finally getting a chance to talk.
I was so excited to hear from you. I have literally been following you on social for years. I am such a visual learner, and just the way you show things and explain it is so incredible that even with what I do every day, I'm having these aha moments and learning from what you do. So thank you.
Oh my God, my jaw's dropped. I feel so validated. All right, so let's learn a little bit about you. Just share a little bit about yourself and what inspired you to write Then Comes Baby.
Sure. So I am an OBGYN in New York City. I am also a mom of two little girls that are 7 and 2. And now I'm an author as well. I had a experience with postpartum anxiety, depression, and OCD that really changed my whole outlook on how I practice, the focus of my practice, how I talk to patients and relate to them and treat them. And now I really focus on perinatal mental health support, diagnosing, treating, making sure people have the right resources and support. And all of that kind of led me to realizing there was so much about the process of giving birth and the early postpartum experience that people just aren't prepared for, or they didn't even know could happen. And much like myself, when I was going through postpartum depression, just felt very alone and shocked and shameful in a lot of ways, that maybe I wasn't meant to be a mom, or I just wasn't good at this like other people. And so I really wanted to take those really common themes that I hear all the time from people that are causing them to feel this way and distill it all in an easy to read and kind of like a conversation with a friend type manner, so that people were more prepared and felt less alone on this journey.
That's wonderful. I'm going to go a little off script, and I have a question for you that I wasn't even prepared for. And that's what I just always a heads up to,
I love that.
To the
That's
guests.
great.
That's why. So were you able to recognize your own PMADs? Because I'm guessing you have training in this. And so you see it in others, but were you able to see it in yourself?
Well, now I have training in it, but when I completed residency over a decade ago, we weren't really taught about the breadth and depth of PMADs. And it was more the postpartum visit. If you're asking anything, you're asking how someone's doing. And unless someone is offering up that they're feeling very depressed or suicidal, you're not going any further than that. We weren't doing any screenings at the time. And so I didn't even know about postpartum anxiety or OCD, and I didn't know all of the symptoms of postpartum depression. So I really had no insight into what was going on myself. And it wasn't until my daughter was almost 2 and we were going through New York City being the epicenter of the COVID pandemic. And that's when I kind of hit my low, because I'm trying to hold space for everyone else who's so scared and worried throughout their pregnancies, and also trying to take care of my daughter and not knowing if I'm bringing anything home to her or how infectious it is in kids. And I just kind of hit this low point and put myself on antidepressants because I was like, something's going on and hopefully this will take the edge off. And it was at that time that I was kind of able to get the space and clarity and say, oh my goodness, this is what's been going on for the past almost 2 years now. And that's when I started doing my own personal research and connecting with people in this space and learning more about PMADs. And then I took that knowledge to help my patients and teach my other colleagues and residents, and kind of bring awareness to people in general who are going through this time. Because if I didn't know, how do I expect anyone else to know?
I know that's kind of crazy that the mental health part is not part of what OBGYNs and midwives and care providers are taught. Because I know that you're not a social worker, you're not a psychiatrist or psychologist, but one would, and we'll talk about the cracks in the system because this is clearly one of them.
There's so many.
But it is kind of mind-boggling that you, who was in this field, didn't have that training. So, well, that kind of leads me into just your openness, which I really respected, that you were open and sharing your own experiences with postpartum depression. So what do you hope the readers, especially the new parents, can take away from your personal story?
I think it's important to share openly and authentically and create that vulnerability to show others that things can go off course and you can struggle no matter who you are and what your background. And besides being a physician, I'm in a very privileged situation. I live in New York City. I'm a white woman. I have a lot of resources available to me. And even with all of my knowledge and education and resources, I still struggled so much in my first couple years postpartum with my first child. And I just share this to help others see that, one, all of these things we go through are very pervasive, whether it's PMADs or other struggles during your birth or postpartum experience. But also that it doesn't mean that you're a bad mom or there's something wrong with you. And so I just really, that feeling of feeling so alone and like, maybe I'm not cut out for this. When I see that in other people's faces and in their stories, I just want to hug them and hold them and be like, we all go through something during this that wasn't what we expected, but you are still an amazing mother or parent, and it will get better.
Yeah. Oh, that's so great. So let's circle back to the cracks in the system, because we're just kind of alluding to that. So when you talk about the cracks in the system, when it comes to postpartum care, what are some of the biggest gaps you're seeing, and what are some small changes that could be made that could possibly make a big difference?
Right. And in care in general, the whole postpartum time period is a gap in care. There's really nothing there.
It really is a mess. Can we just say that? I mean, it's really shockingly a mess how little postpartum care there is compared to, especially right up to birth. You're seeing your patients once a week after 36 weeks, and then all of a sudden it's long gone. You just don't see them for 6 weeks if they come in.
Right. And even before the birth, there's not even much preparation for what's going to happen afterwards. And when people get their discharge instructions from the hospital, they're very overwhelmed and sleep deprived and have this new person that they're worried, how am I going to keep them alive? And then they're trying to listen to instructions for warning signs of what to reach out for. It's just like, there's really nothing there. And the whole system is just 1 6-week visit unless you had surgery or a complication where you need to follow up sooner. And so otherwise, we're leaving it up to people to reach out if they have any major concerns. And other than that, they're on their own. And society also makes it seem like we naturally know how to mother and caregive, and it doesn't even touch on how to take care of ourselves in this period, how to get the support and resources around ourselves so that we can not just survive, but thrive. And so the whole period, there's really nothing there. And if you're lucky enough to have the resources and support of a good community or family or a partner that really shares the burden, that can take some of the load off. But for most people, they're really trying to do everything on their own and focusing on their baby and the rest of their family and not doing anything to care for themselves physically, mentally, emotionally, because that's how we're taught moms are supposed to be, right? We're supposed to sacrifice and be the caregiver and take care of everyone else before even thinking about our own needs.
What I find really interesting, and you might know the stats better than me, I believe ACOG, I know ACOG says, American College of Obstetrics and Gynecology for listeners, that ideally it should be a 2-week, and here's where I can't remember if it's either 8 or 12-week checkup, but insurance won't cover that. So that's why the 6-week is the situation, which is also crazy, because another statistic, and please again, correct me if I'm wrong, the highest chance of incidence is in those first 42 days postpartum. And most people don't even see their care provider then. So the system really is not setting people up for success. Now, I happen to have a home birth midwife who did things a little differently. I think they have that luxury of less clients and a little more personal attention. And she came to visit. She had to also do the PKU test, so she came back. But she came to visit a few times. Then she had me do a daily check-in, I think like the first 2 weeks. And that is well beyond the typical. But I know in other countries, they have a very different postpartum system set up. I feel like we're letting down our new parents.
We are. We're not giving them anything. And often new moms are having to go back to work between 2 and 4 weeks postpartum. So they're not even getting to that check-in before they're forced to go back because they need to keep their job, to bring in money to the family. So we're not even giving them that time they need to heal and bond with the baby and feed the baby and just go through some of this early part of matrescence before we're throwing them back out into the world. And then we don't give people adequate childcare either. So there's just so much of this that other countries bring other support around. And also in a lot of other cultures, there are systems in place for new parents so that relatives like their mother or siblings and aunts and uncles or other women from the community are coming and caring for them during this first 30 to 40 days postpartum. They have a period of confinement. They're being fed and massaged, and they're helping them take care of the baby and telling them stories about their own journey to motherhood. And so that really creates a beautiful experience and welcomes a new mom into this life, and also says it's okay for you to rest and recover and be taken care of and be mothered yourself during this very vulnerable early transition. So we don't have any of that. And that's not even mentioning all of the things that you're looking for in that early period that you were talking about with maternal morbidity and mortality, these very serious complications that can happen. And often, even if somebody is calling a provider, they're being dismissed. And that's when you see and hear stories about women who had blood clots or had seizures or a heart attack, and these things are going unnoticed.
That's so upsetting. Do you have any ideas, when you work with your clients about how to make some changes, or how do you work with your clients to is it possible to check in more? I can imagine that you're just, the care providers, you guys are busy. You don't have a ton of time.
Yeah, I am lucky now. I moved to a practice called Oula that is a women's health startup, and it's midwifery-led, but collaborative care with OBs, and midwife care is very holistic. It's part of why I went there. And so we are talking to patients throughout their whole pregnancy, and in the hospital when they give birth, we are spending a lot of time with them on rounds in the days before they go home, talking about all of the things that might come up and letting them know that they can call us anytime 24/7. And I think that's part of what we're missing, because in most practices, it's hard to get a hold of your provider. And because they're so busy, often they're not bringing you in for concerns, or things aren't called back in a timely manner. And we have a whole remote care team that is incredible, of MPs and nurses. And so they're connecting with these patients as soon as they call. Someone's picking up the phone and assessing how everything's going. And we don't hesitate to bring people in for extra visits. We know they're not going to be paid. It's just part of the prenatal bundle, but you have to make yourself available, and you have to let people know it's okay, and you're going to be there and listen and not dismiss them. Otherwise, people aren't going to reach out.
Yeah, I love Oula. I mean, we have now, especially with you guys on the Upper West Side, we have a lot of our students that use those services, which is fantastic. I love the combination. And this, sorry, folks, this is not trying to be a whole, commercial for Oula, but I really do love that it's a combo of midwifery with OBs to have that collaborative care. I think it's fantastic. Right. All right, I'm going to pull us back on topic.
So I wish everyone could have a midwife and an OB and a doula and, a physical therapist and other resources.
I know. Oh, all right. So what are some of the most common misconceptions you see around pregnancy or childbirth that you wanted to correct or challenge in your book?
I think the biggest thing that you see come up a lot in my writing and what I'm always trying to let people know is that and this is something that a lot of people don't want to hear, but it doesn't matter how prepared you are and how healthy you are and how much exercise you're doing and your diet and, taking your prenatal vitamins and doing exercises to prepare for giving birth. Things can go off plan.
Mm-hmm.
And it doesn't mean there's something wrong with you or your body. It's just that so much of this process is out of our control. And it's scary to think about that. And so a lot of people have trouble sitting with that and acknowledging that. And that's when we see people who are so anxious and trying to control every aspect of things. But that makes it even harder if something happens like an unplanned C-section or struggles with breastfeeding. And so I really want to create space for that and flexibility and saying, while we will support you and want you to have the birth you want and the postpartum experience you want, if things go off course, these are things we can do to still support you and help you be okay with that and it not end up being this very traumatic experience that can lead to not just trauma, but anxiety and depression and feeling like there's something wrong with you or your body.
Mm-hmm. That's why when I talk to my students about birth plans, I actually use the word birth preferences because I feel like plans make it seem like it's a guarantee. But as you just said, it's so rare. So I only attended a little over 100 births as a doula, but I would say from that, rarely did I see it go exactly as someone had envisioned. Something always comes up. And I love your idea about having the other support around to kind of go with the swerves of what happens, because you're totally right. When people are attached to certain ideas, that's when the trauma or the feeling like, oh, I didn't get it right. They feel more anxiety or anger at themselves after. I'm sure you've encountered that.
Right. And there's so many, you don't know the underlying reasons for why someone has certain preferences. And some of them are related to values. Some things are pressure from society that things should look a certain way. Sometimes they've had healthcare trauma or a history of sexual abuse or something that is making them really want to have control over things or make sure they maintain their autonomy. And so there are still things that we can do, even if things go off course, to help people feel seen and heard and make sure they understand everything completely and they feel like their agency and autonomy weren't taken away from them. And that's why it's so important to have providers who provide holistic care and are in tune with those things.
So if one of your patients comes to you with a birth plan, how do you approach that so that you do remind them of the flexibility and relieve some of the pressure of getting it right?
Yeah, we always go through birth plans fully. And if there are certain things, certain interventions that they would decline or don't want, it's always important to understand the why behind it and answer any questions. And sometimes that changes the perspective of how someone's looking at an element of their birth plan. And sometimes you realize the core value behind it, but are able to introduce other things like, okay, if we do, like, say, for instance, you really want to avoid an induction because you want to let your body labor in spontaneous labor and you're trying to go unmedicated and you're worried an induction will lead to a C-section. So what are the elements of this that are like most important? What do you value in this? And how can we keep that even if we do have to end up having an induction for one reason or another? And so it's kind of just you really taking the time and having the conversations and understanding where preferences are coming from and how we can work with that even when the situation changes. Which most providers, again, in like a system that doesn't really reimburse prenatal care well, they're not spending the time or have the time to go through this. And some people will go through it more with their doula or other support system, which can be helpful. And often, like in the hospital, the labor and delivery nurses are really good about helping out with patients to maintain elements of their birth plan. But yeah, providers should definitely, if you start broaching it early and often with them, get your provider to go through it little by little at your visits.
I love that you're saying that, because I cannot tell you how many times students will come in and say, oh, I tried to talk to my care provider about whatever. Let's say this happens a lot. Like we'll talk about pushing positions in class. And so then a student will be like, oh, I tried to talk to my care provider, but they said, we'll wait till 36 weeks to have that talk. I actually think that's a red flag that they're being kind of pushed off.
Yeah.
So I'm glad that you're saying, talk about it often and early. Okay, we're going to take a super quick break. When we come back, we're going to shift gears into the identity shift of matrescence. All right, we'll be right back. Okay, we are back. So I love that you write so candidly about the identity shift that comes with new parenthood. You already referred to it, matrescence. What helped you personally through that process, and what do you recommend to others navigating that transition?
I think for me, what was so valuable and the most important thing during that time was I joined a group for new mothers in the first few weeks after my daughter was born. And it was a group of like 10 women. And this was pre-COVID, and we met in person. And so we were all sitting around in a circle, and it was led by a doula and talking about different topics every week. And it just really helped validate a lot of my feelings and emotions and understand that I wasn't the only one going through certain things. And I think that is really important no matter where you get your community from, whether it's an online group or friends or family members, people who've gone through it before. But just having someone else to validate your feelings, someone that you can talk to authentically, because a lot of people will just say, I'm great, everything's great, motherhood is pure bliss, it's amazing. I just fell in love with my baby immediately. And you need to have people that will also be vulnerable and share the things that don't coincide with how society says we should think and feel after having a baby. And, anything else that goes off course in your experience, they can validate the feelings you have around that. So that's what helped me the most. And just getting little text messages from people checking in and me checking in with them as well. I think that just made the biggest difference to not feel so alone.
Yeah, I clearly believe in community. That's a part of PYC.
Yeah.
And I really do think, especially you and I are in the New York area, so knowing that many of us show up here without our family or necessarily even our friends around, and having to make our own community is really important. So I'm glad you shared about that. And even now, if maybe you can't meet in person for whatever reason, there's so many online ways for those listening to reach out. But I do think those, like you said, just little text messages of someone saying, hey, thinking of you, how are you doing, can feel really like, sending you that life raft or whatever. I'm envisioning that little circular floaty device, like sending it out to you, and you might feel just a little overwhelmed. Totally. So in what ways, we talked a little bit about this earlier, but in what ways do you think our culture is failing new parents, especially when it comes to emotional and logistical support and postpartum care? Because like we said, you're just kind of left on your own for the most part.
Right. I think it does come back to that lack of community and lack of awareness, and society kind of pushing this patriarchal image that moms are supposed to be the primary caregivers and be with their kids and love doing it 24/7. And it should be easy. It's not hard work to take care of your baby. Maternity leave is not a job. Not valuing the work and time and effort and emotional toll of caring for an infant. I think that is just adds so much to the inability to create change around this time. But I think there are a lot of advocates and policy changers and people kind of putting a voice to this and raising awareness about what is going on for people during matrescence and during that early time, and working to change things so that we can get better quality maternity care and postpartum care and affordable child care and better paid maternity leaves, so that people have the time and space and support to get through this period. Because a lot of what I see when I'm dealing with the emotional struggles of people, a lot of it is just from being so burnt out and overwhelmed and trying to carry the load of it all on their own or with very little support. And so sometimes the first steps in getting people mental health is to help them find out who they can bring in to help give them support. And when someone offers to help, say, yes, you can come cook. Yes, you can come clean. You can babysit for a few hours so I can get out of here. We just don't have the full language and the full awareness of that yet to get the right help for people during this period.
It makes me so sad that we don't have that. I've been in this field for now 23 years and changes have been made. But when I feel like it comes to postpartum, I still feel like we're not that far from when I started back in the early 2000s. I've seen changes in pregnancy. I feel like midwifery care has come a little more to the forefront. I feel like there's more respect for birthing choices, but I still feel like postpartum, we're kind of stuck. And I know there's policy changers out there working really, really hard and advocating. I hope it happens for all those new parents. So what part of Then Comes Baby was the hardest to write? And what parts are you most proud of?
The hardest parts, I think, were some of the parts just reliving parts of my experience and going back to that time and who I was then and how I felt just so defeated and alone. And, it's hard to go back to those places, but then also I feel so proud of that because that changed everything that I've done. It created this passion and, this new way of caring for people and supporting them in the work that I do that I love helping people throughout this time. It's the most incredible thing. But those were some hard things to write. And it's also what I'm most proud of because I think it helps create connection to people who are reading. When you can be vulnerable with them and show them your struggles, I think it makes me not just this expert. I'm not just a physician who does OB and mental health care. Like I'm a mom and I've been there and we are all connected by that bond.
And I also think that when people are reading that to be like, wow, this happened to her too. And she's an OB and this is her world and this still happened. I think that is so validating for someone that's struggling. And I know for me, I had a really challenging first birth and I had to come to grips with how did that happen? This is what I do. And it led me to actually changing how I was approaching my work. And it sounds like this actually also, as hard as it was to live and then relive while writing it, it sounds like it gave you that catapult into really supporting people, not just from the physical part of obstetrics, but really that emotional part.
Yeah. I mean, I really wasn't in tune with any of my emotions at all before my first daughter. I locked everything away inside and, from childhood, like you just don't talk about the hard, uncomfortable things.
I love your honesty.
So once I had her and I was like, okay, I have to open up and be connected to her. And now, it changed so much of how I practice in every way. This matrescence, it just changes us completely, but all the struggles as well. And now when I'm sitting with my patients and can be like, really, how are you? And when they're telling me things saying, that sounds really hard. How are you coping with that? What's going, and I keep tissues in all my rooms now because everyone just cries because they just let go and they take that sigh of relief and breathe out and be like, okay, someone's here and I'm not alone and they want to listen and hold space for me. And I think that's the most beautiful thing is because in New York, we care for people from all over the world, right? From every population, people who have every insurance or uninsured, and no matter where they come from and what their story is, there are elements that we can connect about just because we've both birthed babies.
I'm totally again kind of just shooting from the hip as you're speaking. Do you ever work with newer doctors who might have also not had that experience and try to invite them into that empathetic space? When they're working? Yeah.
Yeah. I talk to newer doctors all the time about the art of conversation and creating that safe space for people and encourage them to be in the room, whether it's on labor and delivery or in their clinics or whatever, with providers who they see are really good at conversation. And you can learn, it's a whole nother skill set. And I learned a lot of my skills from working with reproductive psychiatrists that really helped me to sit and listen to them and how they talk to people and counsel people, and some really good like high risk obstetric doctors who often are delivering very difficult news. And some of them just do it in the most beautiful way and really sit and listen to the people and hold space for them as long as they need. And so I think that's such an important skill. And part of the work that I've done over the years has been helping create curriculum and training for people who are currently medical students and residents so that they graduate with the comfort and knowledge to be able to have these discussions. So I think it's so important. And I think catching people at the beginning of their path, they are still
malleable.
And they're so excited and they're so idealistic and they're not, like burnt out and so
jaded.
They're not so jaded. Yeah. And it's so sweet when they're like, I want to talk to her about this and the mental health, and I want to be able to provide that level of support and care. And it's really good to see that in the younger generation.
Oh, I love that you're doing that. Okay, we're going to take one more break. When we come back, what is one final tip or piece of advice you'd like to offer for new and expectant parents? Right, chew on that. We'll be right back. Okay, we are back. So I'm curious how you're going to approach this because you've got a lot of hats. So let's see which one you put on for this. So what is one final tip or piece of advice you'd like to offer new and expectant parents?
I think it's really important to know that your health, your self-care is so important for not just you, but for your baby and your whole family. And I think that's something that people often forget when they're focused on doing everything for their baby and they're just not getting any sleep and they're not taking any time for self-care and they're not even thinking about all of this that they're going through, is that taking care of yourself is taking care of your baby. It helps you be able to be grounded and present and in the moment and develop these healthy bonds with your baby. And so it's not just for you, it's for everyone. So if you won't do it for yourself, do it for everyone else around you.
Oh, that is great advice. And where can people find your work and your book?
So I am at Dr. Jessica Vernon. .com. I have a website. That's my Instagram as well. My book you can find at any major bookseller. And that's it.
Oh, Jessica, this was so great connecting with you. Thank you for sharing about your experience and your knowledge. And thank you for writing really a wonderful book.
Thank you so much. That means so much coming from you because I think you have such a beautiful community and you share so much good information with people out there that it is definitely approved by my OB community and my patients.
Oh, thank you so much.
This has been an episode of Yoga Birth Babies, produced by Prenatal Yoga Center. You can catch us on Facebook, Twitter, Instagram, and Periscope. I'm Deb Flaschenberg. Thanks for listening.